Sometimes rescuers will only give breaths without chest compressions. This is called rescue breathing. Ventilation is more effective when providing rescue breathing for an unresponsive, non-breathing victim when you use a bag mask system. A bag mask device consists of a ventilation bag and a face mask. The bag may or may not contain a valve to prevent rebreathing of exhaled air. The bag mask system is the most common method of providing rescue breathing in healthcare settings and during two-rescuer CPR. It can be used with or without an oxygen source and comes in a variety of sizes. If you're using supplementary oxygen with the bag mask, the delivery method is exactly the same as without supplementary oxygen. Deliver each breath over 1 second, making sure you do not deliver the breath too quickly or forcefully. This will help reduce the chance of gastric inflation, air going into the victim's stomach instead of his or her lungs. If too much air enters the stomach, it can cause vomiting and potentially aspiration. If you're performing two-rescuer CPR, you can use the EC clamp technique to hold a mask in place. This technique requires instruction and practice. Here's your chance to do it. As before, practice along with the video. Are you ready? Here we go. First, position yourself directly above the victim's head. Place the mask on the victim's face using the bridge of the nose as a guide. Use the thumb and index finger of one hand to make a C to press around the edges of the mask. The remaining fingers of your hand should form an E to lift the angle of the jaw and open the airway. Make sure you squeeze the mask with your thumb and the heel of your hands while lifting the jaw to achieve an airtight seal. Squeeze the bag with your other hand or push it against your leg or body. If the chest doesn't rise, then you are not providing adequate breaths. Adjust the mask, reposition the head and neck, or administer a larger amount of air. With or without supplementary oxygen, give 1 breath every 5 to 6 seconds. Practice this now for 1 minute.